Hello, my name is Dr. Martin Janout. I'm a fellowship-trained orthopedic surgeon at Northwest Orthopaedic Specialists, and I specialize in elbow, hand, shoulder, wrist, trauma, and fracture care. I also specialize in treating hand, shoulder, wrist, and elbow conditions such as carpal tunnel syndrome, hand, wrist, elbow, and shoulder arthritis, tendon lacerations, and hand and wrist deformity after brain and spinal cord injury, among many others. I also have additional training in shoulder replacement surgery for arthritic and post-traumatic conditions. In this video, I will be discussing shoulder arthritis. Your shoulder joint is made up of the humerus or humeral head, which is the ball of the ball and socket joint, and the scapula or glenoid, which is the socket. Shoulder arthritis occurs when there is no longer cartilage between these two bones due to wear and tear, rheumatoid, an infection, or a traumatic injury. There are 5 different types of shoulder arthritis. The first is osteoarthritis, which is also known as wear and tear arthritis. This destroys the smooth outer covering of the bone. As the cartilage wears away, it becomes frayed and rough, and the protective space between the bones decreases. When the bones rub against each other, you experience pain. Rheumatoid arthritis is the second most common type of shoulder arthritis. Rheumatoid arthritis is a chronic disease that attacks multiple joints throughout your body. It is symmetrical, which means it affects the same joint on both sides of your body. Rheumatoid arthritis is an autoimmune disease. This means that the immune system attacks its own tissues. The third type of shoulder arthritis is post-traumatic arthritis. This is a form of osteoarthritis that develops after an injury, such as a fracture or dislocation of your shoulder. The fourth type of arthritis is rotator cuff tear arthropathy. Arthritis can develop after a rotator cuff tendon tear that has been left untreated. Because of the tear, your rotator cuff can no longer hold the head of the upper arm bone reduced in the socket, which leads to cartilage damage. The combination of a large rotator cuff tear and advanced arthritis can lead to severe pain and weakness, and you may not be able to lift your arm away from your side. The fifth type of shoulder arthritis is avascular necrosis, which is a shoulder condition that is very painful and occurs when your blood supply to the head of your upper arm is disrupted. Your bone will die without blood supply, and this can ultimately lead to destruction of your shoulder joint and arthritis. The most common symptom of shoulder arthritis is pain, which is aggravated by activity and progressively worsens. You will have limited range of motion, and it will become difficult to lift your arm, to comb your hair, or reach up to a shelf. You might hear grinding, clicking, or snapping sound as you move your shoulder. Shoulder arthritis is initially treated non-surgically. Rest and change in your activities is common to avoid provoking more pain. Anti-inflammatory medications should be taken along with applying ice to your shoulder for 20 minutes 2 times a day to reduce inflammation. Physical therapy exercises may improve the range of motion in your shoulder. If your shoulder arthritis is not relieved with non-surgical treatment options and is still causing you pain or disability, surgery may be necessary. There are 2 surgical options used to treat shoulder arthritis. The first surgical treatment option for shoulder arthritis is shoulder joint replacement. Shoulder joint replacement is used to treat advanced arthritis of your joint. During this surgery, the damaged parts of the shoulder are removed and replaced with artificial components called prosthesis. There are 3 different replacement options, including hemiarthroplasty, total shoulder arthroplasty, and reverse total shoulder arthroplasty, all of which I perform. The second surgical treatment option is a shoulder arthroscopy. This procedure can be occasionally used to treat mild early arthritis for pain relief in young, active individuals. During a shoulder arthroscopy, I will insert a small camera called an arthroscope into your shoulder joint. This camera displays pictures on a monitor, and I will use these images to guide miniature surgical instruments as I clean out the damaged parts of your shoulder joint. Since these instruments are small, this allows for a smaller incision into your shoulder. Shoulder arthroplasty is very effective in reducing pain and restoring range of motion in your shoulder. Although shoulder replacement surgery is not intended to help you return to heavy manual labor, it will allow you to return to your active lifestyle and resume activities such as gardening, playing golf, and skiing. To learn more about shoulder arthritis, please visit our website. Thank you for choosing Northwest Orthopaedic Specialists.